simply is a scope bill, but it is about protecting the scope of chiropractors. It is extremely important that we all recognize what we are trying to do here. In the state of California, every single profession is allocated a particular scope. And that's extremely important because you don't want other professions to incur into someone else's scope if, in fact, that is not the law of the state of California. Absent that respect of scope, then what you're going to have are different professions intruding into different scope.
Excuse me, Senator Yee, we're going to just pause for a minute and establish the quorum.
Thank you.
Secretary, please call the roll.
Price.
Here.
Emerson. Here. Block. Corbett. Galgiani. Hernandez. Here. Hill. Here. Padilla. Weiland. Yee.
Here.
Yee.
We have a quorum. Senator Yee, you may resume.
So you're going to hear some testimony from the opposition that says, well, you know, we have been doing some of the things that has been referenced by, our profession as something that we're able to do. We have gone to classes and schools and training in order to do certain things. That is clearly of question for the chiropractors. You know, all of those may be true, but what is not true is the fact that the physical therapists cannot do what they claim to do and still be legal, because it is not within their scope of practice. And that is the essence of this particular bill. All this bill does, and let me just reference that section within the bill, is on section 1, and this is line 5. And that is, or portions of that, but line 5 is the operative. And let me just read the section of 734 starting on line 3. Notwithstanding any other law, a healthcare practitioner subject to the regulation pursuant to this division shall not be authorized to perform joint manipulation and joint adjustment. And then I would make reference to the scope of practice of the chiropractors, and this is in their scope. And let me just read very short. A duly licensed chiropractor may manipulate and adjust the spinal cord and other joints of the human body, and in the process thereof, a chiropractor may manipulate muscle and connective tissues related thereto. And that's all this bill does. It just simply reiterate, codify, memorialize once again that this is the scope. And so if you have someone coming up and say, you know, gee, I have some training in this particular area, or I've had a body of study that helps me to do manipulation adjustment, that's fine. But you cannot do that within the state of California, because under your title, you are not eligible to do that because that's not within your scope. And what has happened is that there has been incidents upon incidents where there are individuals invading the chiropractor's scope of practice, and that is the problem. That is the same as if a psychologist myself, you know, seeing a patient, giving them a personality test, and oh, by the way, let me do some manipulation and adjustment because I've taken 2 years or 3 years or 4 years or 5 years of study in terms of how to do manipulation and how to do adjustments. I can take all the courses I want, but within my scope of practice as a psychologist, I can't do that because the scope defines what is it that I can do. Now, if I want to do that, then I ought to maybe go to a chiropractic school and get that particular training and pass the exam, and thereby able to enter into that particular scope. And that's all this bill will do. And with that, Mr. Chair, urge an aye vote.
Thank you. Any witnesses in support? Please. Ladies and gentlemen, hand clapping is not appropriate at this time or at any time during the hearing. You're certainly welcome to do that outside. First witness.
Good afternoon. I'm Dr. Kenneth Weiner, the Governmental Affairs Chair for the California Chiropractic Association. Thank you for the opportunity to address this committee. The CCA is the sponsor of Senate Bill 381, and we thank Senator Yee for authoring this important piece of legislation. Manipulation, also called an adjustment, is a very safe procedure when performed by a provider who is specifically educated and trained in the application of this treatment and who is able to diagnose and differentially diagnose a patient in order to recognize not just the indications for manipulation, but just as importantly when it is contraindicated. The public is put at risk if these criteria are not met by these providing manipulation. CCA does not intend to restrict the current scope of practice of any provider group with this measure. It is our intention to codify these providers who currently have manipulation within their scope of practice in the state of California. We recognize that provider scope can vary from state to state, and therefore education and manipulation may be offered in California schools, even though it's not part of the provider scope of practice in California. As an example, chiropractic colleges in this state might teach pharmacology or minor surgery, even though the California chiropractic scope of practice does not allow us to perform these procedures or to prescribe medication. However, there are other states, such as Oregon, just across the border, in which these are part of the doctor's scope of practice. And on the topic of scope of practice, it's important to realize that a provider's scope of practice defines what they are allowed to do and does not describe in a complete way what is not allowed. We have met with a variety of provider groups to address their concern that their current scopes of practice are not affected by SB 381, and we are working with the naturopathic physicians, the physician's assistants, and the veterinarians to take amendments to ensure that their providers are not restricted from procedures that they are licensed to perform. Our discussion with the Physical Therapy Association representatives left us at an impasse. Their scope of practice allows them to perform active and passive exercise, and we all agreed that it was within their description of passive exercise that allows them to perform various degrees of mobilization. We believe that a physical therapist is acting within their scope when mobilizing a joint up to the end of its passive range of motion. Once a joint is taken past its normal end range of motion and a thrust is applied and a crack or a click is heard, it is no longer mobilization of the joint. This is considered a manipulation or adjustment, and according to an Attorney General opinion, a physical therapist is not licensed to perform this procedure. There is no subsequent AG opinion that supersedes this. We recognize that physical therapists are allowed to perform manipulation in some states, such as Oregon and Arizona. However, other states restrict them from this, and in fact, the Attorney General in Nevada just issued an opinion in response to similar concerns in that state in February of this year that prohibits physical therapists from performing manipulation. The CCA will be willing to participate in a working group that includes committee staff, college representatives, stakeholders to discuss necessary levels of education and training required to safely perform manipulation by any provider groups who wish to introduce legislation to expand their scope of practice to include this procedure. Thank you.
Thank you for your testimony. Next, please.
Thank you, Senator Price and committee members. Thank you for allowing me to speak to you today. I'm Dr. Jeff Steinhardt. Although I am a chiropractor by profession, I'm not here to speak to you in that capacity. I'm here to speak to you in my capacity as a past chairman and member of the State Board of Chiropractic Examiners, which is the chiropractic licensing board in the state of California. I was not solicited by the Chiropractic Association to be here. This is an issue as a board member we brought up for discussion, and I felt it was important that you hear from a consumer protection advocate where my expertise lies in. I was a member for the board for approximately 12 years, and I left the board a year ago, so my board history is current. And as you know, the charge of the board is to provide consumer protection by licensing and regulating the chiropractic profession, and not to promote the practice of chiropractic. One of the board's concerns and discussions involved who the public could turn to with a complaint or an injury that was caused by a non-chiropractor when an adjustment or manipulation was improperly applied. What board, if any, should or could perform this task? The board was aware of this problem, as we did receive complaints from the public about non-chiropractors performing spinal manipulations and causing traumas. The board members that were chiropractors saw these types of patients in their office. Also, as board members, we knew very well about the chiropractic practitioner, that a chiropractor spends many years in school learning proper diagnostic processes, indications and contraindications for a manipulation, and how to perform an adjustment properly and without endangering the public. We knew there were rigorous national and state testing procedures in place to qualify a person to become a doctor of chiropractic. We enhanced a continuing education program that now requires 24 hours of relicensing education per year, up from 12 hours per year. And the board is strong in investigation and enforcement of complaints against chiropractors. We knew the consumer could turn to the chiropractic board and be comfortable in knowing that their rights were being protected. But we couldn't protect the people that didn't have a board to protect them from manipulations that were improperly applied. Now, as the board, we also knew that the osteopathic and medical doctor could perform a manipulation as it is included in the scope of their practice, but very few do. The board turned to the physical therapy board for discussion of our concerns, but they did not have much interest. Even though the chiropractic board did receive these complaints about physical therapists, massage therapists, or other individuals that were improperly performing an adjustment and were not trained in the proper diagnostic procedures. When this situation occurred, the board staff would forward the complaint onto the appropriate licensing board and inform that individual where to turn to with their complaint, but the board did not know what happened with that complaint. I know that the public is not being protected now from improperly administered manipulations, as I now have an active patient that suffers from vertigo from a spinal adjustment that was performed by a physical therapist. This manipulation was performed despite Attorney General Younger's opinion in 1976 that specifically states a physical therapist may not directly manipulate or adjust the spine or any other bony structure. The state's opinion has not changed since then. When I heard of SB 381, I felt it was my civic duty to speak to you today and offer my support of this bill. Consumer protection is in my blood, and I don't see it, leaving one of the roles I play in my life. SB 381 will close the consumer protection void that now exists and address the concern that the Board of Chiropractic Examiners had while I was a member. And I urge you to vote yes for this bill, and I thank you for your time.
Thank you for your testimony. Next up, please.
Thank you, Senator Price and committee chair members. My name is Dr. David Paris, and I'm from Redding, California. And I'm here today solely representing myself and supporting the California Chiropractic Association SB 381. And I would simply like to relay my experiences currently being employed with the largest healthcare system in the United States, the Veterans Healthcare Administration. And also working within that administration, functioning and acting as a provider in one of the largest patient-centered medical home models within the United States. And my experience has been that within the VA, even though we are all under rehabilitation services and we are all under physical medicine and rehab as a department, when the Veterans Administration decides to provide, at least in California here, the benefit of manipulation, it is solely provided by a doctor of chiropractic at their clinics here. And so I hope that experience relays the importance on safety and consideration in support of SB 381. Thank you.
Thank you for your comments. Are there any others in support, any other proponents in support of this legislation? If you'll come to the microphone and
line up over there.
remember, we're taking the first 50
Who's first? Come on up.
to indicate me too. That's legislative shorthand for me, which means I support this proposal.
Brian Stensler, chiropractor, San Diego. Me too. I support SB 381.
Dr. Terry Riley, San Diego. Me too.
Dr. Tracy Cole, Crescent City, California. I also support 381.
Dr. Robert Walsh, San Jose, California. I support 381. Me too.
Dr. Alice Chalikin, Pasadena, California. I support 381.
Dr. Jeffrey Lee, San Jose, California. Strongly support Senate Bill 381.
Dr. Lance Cohen, La Jolla, California. I strongly support Senate Bill 381.
Dr. Leslie Hewitt, Danville, California. I support SB 381.
Dr. Danny Gambino, San Diego, California. I support SB 381.
Dr. Makani Liu, instructor, Palmer College of Chiropractic West Campus, from Santa Cruz, California, as well as a chiropractor. I support SB 381.
Rachel Garcia James. I'm a student of chiropractic at Palmer West. I live in San Francisco, and I support SB 381.
Dr. Matt Hubbard, San Diego, and I support SB 381. Thank you.
Dr. Jason Schumart, San Diego, California, and I support SB 381.
Dr. Rachel Richards, La Jolla, California, also here in support of Senate Bill 381.
Dr. Brian Kelly, President Life Chiropractic College West, Hayward, California, and past President Australian Spinal Research Foundation, speaking in support of SB 381.
Dr. Mitra Razipur, I'm supporter of the SB 381.
Christopher Busseri, student at Life Chiropractic College West, and I'm supportive of SB 381.
Dr. Leslie Van Dusen of Orange County, California, and I'm in support of SB 381.
Blair Smith, student at Life Chiropractic College West from Foster City, and I'm in support of SB 831.
I'm Gina Fraser from San Jose. I'm a student at Life Chiropractic College West, and I support SB 381.
Kate Bennett, I'm a student at Life West, and I am in support of SB 381.
Melissa Crago, I'm also a student at Life West Chiropractic College and in support of SB 381.
Brett Jones, chiropractic student. I'm in support of SB 381.
Amanda Chow, student at Life Chiropractic College West, and I support SB 381.
Mike Pierce, go to Life West Chiropractic College West, and I'll support SB 381.
Dr. Jennifer Linnes, I'm from Berkeley, California, and I support SB 381.
I'm Dr. Manuel Fonseca, San Francisco, and also support.
Dr. Austin Jones from San Jose, California, and I support 381.
Dale Johnson, PhD, Director of Research, Life Chiropractic College West, and I support Senate Bill 381.
Thomas Milas, a faculty member at Palmer College of Chiropractic West. I live in Pleasanton, and I support 381.
Dr. Angela Lopez, San Jose, California, and I support SB 381.
Dr. Douglas Toth in Petaluma, California, and I support SB 381.
Dr. Sarah Griffin, Victorville, California. I am in support of SB 381.
Dr. Phil Dieter, Almaden Chiropractic, San Jose, California, and I'm in support of SB 381.
Dr. Alex Brown, chiropractor at Max Life Chiropractic, San Jose, California. Me too.
Hello, I'm Simon Ma. I'm a student at Life West, and I'm in support of SB 381.
Dr. Robert Chatfield, Aptos, California, and I'm in strong support of SB 381.
Dr. John Nichols, Milpitas, California. I'm in support of SB 381.
Dr. Kevin Cressy, chiropractor, Pasadena, in support of SB 381.
Dr. Claire Marie Holman, Berkeley, California. I'm in support of 381.
Dr. Linda Berry, San Rafael, California, speaking in support of SB 381.
Courtney Melvitt, a chiropractic intern and student from Alameda, California, and me too.
Dr. Scott Donaldson from Antioch, California, and I am speaking in support of SB 381.
Dr. Ken Martin, Temple City, California. I'm the president of the California Chiropractic Physician Association, and we are in support of SB 381.
Dr. Eric McKillican, in practice here in Sacramento, also faculty at Life Chiropractic College West, in support.
Dr. Rebecca Wilson, I practice in Foster City, California. I support SB 381.
Devin Lyons, student at Life West, and I support SB 381.
Erica Heppy, student from Palmer West, and I support 381.
Dr. Dennis Barker, Walnut Creek, California, and I support 381.
Dr. Devin Waterman out of San Ramon, California, and I support SB 381.
Dr. Grace Lau was from San Jose, California, and me too.
Okay, thank you, proponents, for your presentation and for those who support the presentation in a very orderly way. Now let's move to the opposition. Is there any opposition to this measure? Again, we'll take 3 witnesses in opposition and then 50 who supports. At the table is fine, please. At the table, help us. Pick 3, any 3.
Just 3. Yeah, 4 then.
Okay, you may proceed.
Are we ready to go? Great. Mr. Chairman, I'll get a second here. Good. Mr. Chairman, Honorable Vice Chairman, and fellow committee members, my name is Dr. James Sims, physical therapist and president of the California Physical Therapy Association. And I'm here today before you to report our strong opposition to Senate Bill 381. I've been asked what the effects of 381 will be onto me and my colleagues. And basically, it will cut off my hands. My patients require the use of my hands to bring them relief from pain and from functional limitations. Taking manipulation away from physical therapists is removing a treatment option that is shown to be safe and efficacious component of physical therapy practice. Studies reveal this. This is not my opinion. Unsafe practice, it's told. There's absolutely no data supporting the claims by the sponsor of this bill that manual therapy techniques performed by physical therapists is unsafe. Regarding our training, physical therapy students go through a rigorous training in their entry-level education, as it is mandated by the accrediting body in physical therapy. You'll hear from a speaker who can give you a unique perspective regarding the training that physical therapists receive and that of chiropractors, as this individual possesses both experience in both arenas. Finally, unlawful practice. And I appreciate Dr. Yee's comments about manipulation, but however, he and his colleagues are leaving out a very important word, and that is the term chiropractic manipulation. Any comments that manual therapy, including manipulation and mobilization, is unlawful in physical therapy practice is flat out wrong. Since the inception of physical therapy, the ability to perform passive range of motion to regain motion and function for our patients has been an integral component of the physical therapist treatments. The analysis of this bill clearly shows that numerous healthcare providers utilize manipulation in the course of their patient care. The use of manipulation techniques is not unique to only one type of practitioner in healthcare. The definition of chiropractic manipulation, that manipulative technique which is used to be corrective for diseases and disease process, is well identified in regulation by the Attorney General opinion and as an explanation on the California Chiropractic Association website. However, none of these documents or statements prohibit the use of manipulation by other practitioners in the course of their lawful practice within their scope of practice. The chiropractic regulation itself identifies it as chiropractic manipulation. As stated in the 1980 Department of Consumer Affairs memo, and now again in the full bill analysis for Senate Bill 381, the use of the term manipulation boils down to an interprofessional squabble between professions on semantics. It's ironic that this bill is brought up at this time before this committee. The healthcare system is currently being challenged in a way it's never been before. In 2014, there are estimates that 3 to 4 million, some estimates are as high as 7 million, individuals will have a healthcare benefit for care that they never had before. A lot of work has been done in this building to seek answers for the affordability and capacity problem as the implementation of the Accountable Care Act, healthcare reform, and the Covered California program is commencing. According to a joint Senate Health and BP committee, one way to address the anticipated workforce shortage is to allow healthcare licenses to practice, quote, at the top of their license. That discussion was in this room just last month. This bill does the exact opposite. It will negate the hard work done by Senator Hernandez, the Health Committee, and many other individuals in this building. I respectfully ask for your no vote. Thank you.
Thank you. Any other opposition? Yes, sir.
Mr. Chairman, Honorable Co-Chairman, and members of this committee, thank you for allowing me to speak today. My name is Dr. Timothy Quay. I have been a licensed chiropractor in the state of California since 2001. I am also an expert witness reviewer for the State Board of Chiropractic Examiners. And as Dr. Sim said, I am currently working on my Doctorate of Physical Therapy at Loma Linda University. So my perspective is that I have seen both the curriculum in chiropractic school and physical therapy school. So my analysis is that the curriculum is very comparable. Both teach anatomy, both teach 2 terms of pathology, both teach histology, both teach differential diagnosis. Specifically for safety, one example is that one of the most serious things that can happen with manipulation is rupture of a ligament in the top of your neck, which will cause excessive motion to cause a bone to squash your spinal cord, which is a very serious complication. This can occur in rheumatoid arthritis. Both schools have emphasized this fact and also have taught the same identical test to evaluate patients to make sure that this is not a risk. In addition, both chiropractic and physical therapy school refer to a manipulation as a high-velocity, low-amplitude thrust extending into the paraphysiological space. It is described exactly the same. The moves are actually very similar. In fact, when I watch my physical therapy instructor demonstrate moves, I would not know that he's a physical therapist had I not known so beforehand. He looks identical to a chiropractor or my chiropractic instructors that I saw in chiropractic school. In addition, in physical therapy school, the manipulation is not taught as an adjustment or removal of subluxation, but rather as a means to increase range of motion and also to decrease dysfunction. So I also have photocopies of my notes detailing specific examples where the tests are the same and even the moves are identical for physical therapy and chiropractic school. And it's for this reason that I don't see any reason that a physical therapist is not properly trained to perform manipulations. I believe that the schooling is very comparable. Thank you for your time.
Thank you for your testimony. Are there any other witnesses in support?
Yes, Mr.
I'm sorry, in opposition.
In opposition. Thank you for giving me the opportunity to speak this afternoon. I'm Dr. David Russ. I have been in private chiropractic practice since 1998. I'm qualified to address this issue because between 1999 and 2004, I taught manipulation and other manual therapy skills to naturopathic students at the National College of Natural Medicine in Portland, Oregon. For 3 of those years, I was the department chair. I developed the curriculum, taught the classes, and evaluated the students for competence. I can say without question that naturopathic doctors are qualified to safely perform manipulation. Let me say that I feel very strongly that only trained and licensed practitioners should be allowed to use manipulation. It is very safe when it is done right. And we chiropractors do have the most training but we are not the only ones who are qualified. The main argument against the inclusion of naturopathic doctors and physical therapists is public safety, but there is no evidence to support the idea that naturopathic doctors cannot safely use this treatment. Naturopathic doctors use manipulation in every other state in which they are licensed. And in researching this issue, I got in touch with Mr. Keith Henneman, who is the Vice President of Claims for NCMIC. They are the largest malpractice carrier for naturopathic doctors in the United States. He told me that the total number of claims that have been made against naturopathic doctors for the improper use of manipulation is 0. So there really is no public safety argument here. The argument is an economic one. And I understand that we chiropractors want and deserve to be recognized as the most highly trained in manipulation. Unless the state is prepared to exclude medical doctors and osteopathic doctors from manipulation, since they have no training or little training, then the rule has to include all types of practitioners who are actually trained in manipulation, and that includes naturopathic doctors and physical therapists. Some of my chiropractic colleagues are surprised that I'm here today speaking in favor of inclusion. The overriding principle for me is that this is a very safe, effective, and cost-effective treatment, and the more people in our communities who have access to it, the better. Thank you for your time. I would be pleased to address any questions.
Thank you. Are there any other witnesses in opposition to this measure? Again, we'll take the first 50.
The coroner's reporting actually came from the medical board. They helped us out with expert advice.
Okay, witnesses in opposition, if you can use the microphone, please.
Hello, my name is Dr. Sean Johnson, and I am full-time clinical faculty at the University of Southern California. I'm involved in training manipulation of first-year students, and I'm opposed to this bill.
My name is Dr. Cheryl Lowe. I'm the chair of the DPT program at Cal State Northridge, where students are educated to this technique, and I oppose this bill.
My name is Dr. Christopher Ingstad. I am a full-time faculty at the University of St. Augustine from Oceanside, California, and I teach first-year and third-year students, and I strongly oppose this bill.
My name is Kevin Dean. I'm a student physical therapist at California State University Long Beach, and I ask you to oppose this bill, SB 381.
Hello, my name is Dr. Jeanette Green. I'm a physical therapist as well as an anatomy and physiology professor, and I implore you to vote no on SB 381.
My name is Rob Landell. I'm a doctor of physical therapy and a professor at USC and director of the PT program there, and I urge you to vote no on this bill.
Chris Reed, physical therapist from San Jose, California, and I strongly oppose SB 381.
Dr. Heide Plock from Half Moon Bay, California, and I oppose SB 381. Thank you.
Adam Parker, student at California State University Long Beach. I oppose this bill.
Christopher DePrado. I'm a doctor of physical therapy with the University of California at San Francisco. I help teach some of these mobilization and manipulation techniques. I do not do adjustments, and I oppose.
My name is Dr. Erin Green, and I'm a physical therapist in San Francisco, and I urge you to oppose this bill. Thank you.
My name is Dr. Jennifer Barr. I'm a naturopathic doctor representing the California Naturopathic Doctors Association. We oppose unless amended as articulated by Dr. David Russ.
Dr. Mary Kay Berry, physical therapist, adjunct faculty at UOP. I practice here in Sacramento, and I urge you to vote no on SB 381.
Dr. Elijah Freeman. I'm a physical therapist and a clinical educator, as well as a clinical researcher and director of rehab for Fresno Pacific University, and I urge you to oppose this bill.
Dr. Stanley Parris, Chancellor, University of St. Augustine in San Diego. I urge you to oppose this bill. Thank you.
Karen Chin, physical therapist, Orinda, California. I urge you to oppose this bill.
Donna Matsunaga, physical therapist from Hercules, Contra Costa County. Please vote no on this bill.
Walter Fuller, licensed physical therapist, state of California. Oppose 381.
Dr. Joshua Marion, I implore you to vote no on this bill.
Dr. Paul Gaspar, physical therapist, opposed.
Dr. Jeff Fairley, physical therapist, and opposed this bill.
Dr. Rachel Warman, outpatient private practice, Folsom, California, no vote.
Tim McGonigal from Folsom Physical Therapy. Please vote no on this bill.
Camille Lee, student physical therapist at UCSF from Orange County. Please vote no.
Anne-Marie Everett, DPT student at UCSF SFSU, and I strongly oppose SB 381.
Elizabeth Friedemann, student of physical therapy at UCSF San Francisco State. I strongly oppose this bill.
Hello, Michael Williams, physical therapist from Morro Bay, representing the 70-plus therapists for Team Movement for Life. I strongly oppose this bill.
Dr. Tony Pizzelia, I'm a physical therapist, and I please urge you to vote no on SB 381.
Dr. Chris Tinker, Monterey, California. I strongly urge you to vote no on. Thank you.
Valerie Watase, Lafayette, California, physical therapist. I vote no, please.
Dr. Steve Ryan, I'm a physical therapist and assistant clinical professor at UCSF, and I strongly urge you to vote no.
Dr. Megan Scamenda, physical therapist in San Francisco, and I urge you to vote no.
Dr. Tara McGann Friedman. I'm a physical therapist and clinic owner in San Francisco, and I strongly, strongly oppose this bill. Thank you.
Dr. Robert Snow, San Diego, California, physical therapist, opposed.
Benjamin Nichols, physical therapist, Fresno, California, and I oppose this bill.
Paul Smith, physical therapist, Fresno, California, practicing clinician and adjunct faculty at Fresno State University, and I strongly oppose this.
I'm Dr. Julie Whitman. I am a researcher in the area of spinal manipulation and also an educator in the same area. I'm from Roseville, California, and I urge you to oppose this vote.
I'm Dr. Joe Farrell, private practitioner, physical therapist from Castro Valley, California. I have been a researcher in spinal manipulation a number of years ago and an educator, and I strongly, strongly oppose this bill. Thank you very much.
Dr. Annie Burke-Doe, physical therapist, faculty at University St. Augustine. Please vote no.
Nancy Bell, professor at the University of California, San Francisco, a physical therapist practicing for 50 years and a researcher. I strongly support against 381.
Dr. John Gray, San Diego. I strongly oppose this bill.
Dr. Catherine Patla, clinician, Dean of Post-Professional Education, and a faculty member, University of St. Augustine, San Marcos. Please oppose this bill.
Dr. Susan McGinty, Professor Emeritus at California State University, Sacramento. I strongly urge your no vote on SB 381. Thank you.
I'm Mike Corey, physical therapist, Castro Valley. I oppose.
Stephanie Dickerson, Doctor of Physical Therapy, Berkeley, California. Please vote no.
Jack Chan, Doctorate of Physical Therapy, student from the University of Southern California, and I urge you to vote no on this bill.
Louis Gabbard, Doctor of Physical Therapy, Vacaville, California. I strongly encourage you to vote no on this bill.
Robert Huey, Doctor of Physical Therapy, student, University of Southern California, Pasadena, California. I urge you to vote no on this bill.
Kristen Anderson, student of physical therapy at USC. I strongly urge you to vote no on SB 381.
Carol Jo Titchener, Castro Valley. I'm also from Kaiser Permanente, and we have taught these techniques across the state for over 30 years.
Okay, I want to, first of all, Senator, thank you for your leadership on this issue, and I want to thank both sides for a very orderly and informative discussion. And I guess our question before us is making the proposed changes in statute to define joint manipulation and adjustment, the best way to proceed, or should we direct the Board of Chiropractic Examiners and the Physical Therapy Board to continue their discussions to try to figure out the role of, or to review, I should say, the grade 1 through 5 exercises to tend to according to each profession's scope of practice, figure out, is that a better way to come to some voluntary agreement as we work these issues through. I'm certainly in favor of more discussion, but that's just one opinion. Members, any thoughts? Senator Emerson.
Thank you, Senator Price. I would like to have a discussion or a question to the former board member. It's my understanding that since 1990 there have been only 5 complaints against physical therapists. Those 5 identified complaints were not submitted as a result of a patient harm, but rather by chiropractors concerned with the physical therapists practicing outside their practice. Can you address that issue?
Yes, I can. As a board member, we are, hidden away from the daily operations of the board because we are the judge and jury in cases. So specifically how many of these cases come across the board staff, I am not privy to, or as any board member. This was an issue that I brought up in discussion during my last few years on the board as far as, where is the consumer protection for the manipulation? We knew we had chiropractic handled, but what about other people that were doing it, maybe someone doing it unlawfully, non-licensed, or thought they were in the proper license. So I can't answer your questions. I don't know how many exact numbers are there. I know I've been in practice for 25 years, and I've seen that at least 2 of these people come in from my office from physical therapy adjustments, and I've had about 3 others from boyfriends, girlfriends, or self-manipulations that were causing trauma.
So it's my understanding there have been actually 0 patient complaints against physical therapists to your board, and there have been 0 complaints of chiropractors to your board.
I would think that would be inaccurate.
No complaints by physical?
No, I believe that there are complaints.
Well, that's not what the board told us. Thank you.
Any comments? Senator Wyland.
One of the challenges that we have on this committee, as you can imagine, with all the scope of practice issues, is to try to come to a decision in areas that, frankly, we don't have expertise. And because of the way we're set up, this isn't like a trial where you have days of testimony and where you may see the actual therapies that you described performed. So I just wanted to talk a little bit about the challenges and why it's so difficult for us. Number one would be we've had a lot of material here, and both the chiropractors and the physical therapists have submitted a lot of material. Without seeing it actually perform, number one, it's hard to understand exactly. We see it described, we've had drawings, but understand it exactly. Now, some of us have experienced this personally, so there's some personal experience. Number two, it's really hard to evaluate the training differences. We've heard in testimony that they're very similar, but is that is that training that's more recent, and that the training for more recent graduates, for example, in physical therapy, includes things that didn't historically? It's very difficult for us to evaluate that, and for me. And finally, we had various legal opinions, and it's hard really, you have Department of Consumer Affairs, you have a couple of other legal opinions that aren't as clear as they might be. So at this point, I just can't, I don't feel that I really have the understanding enough to make a decision that obviously is people feel very passionate about on both sides. But that's sort of an explanation of why I've not been able to come to a decision.
Senator Hill.
Thank you, Mr. Chair. This is a tough issue, and thank you, Senator Weiland, for pointing that out because of the challenge that we're faced with today. And I've had many years of experience on chiropractic and manipulation and the issue of resolving some of the subluxation problems that many of us have, and strong supporter of the chiropractic profession. As of a few days ago, I was very supportive of this piece of legislation and thinking that the issue of manipulation, as defined, is relative and relegated to the chiropractic profession. That's the way it was framed to me. That's the way I had understood it. And that's the way I felt it, and I was willing to support that conclusion. Then, in looking at the research, and by the way, the staff analysis was superb. I just want to congratulate and thank you for an outstanding, fair evaluation of the issues and the challenges that brings. But what came from that? Number one, as Senator Emerson pointed out, the number of complaints that we've seen and that have actually moved forward can't be identified. Secondly, the issue of manipulation and the fact that it is kind of within both scopes of practice. When you see it in, whether it's the grade 5, I guess, when you're looking at the grade 5 mobilization, it's called a manipulation. And so that actually clouded the issue for me, and my conclusion is where Senator Weiland's is. I don't feel that there's enough evidence that indicates a need to make a change, and I would support the chair's recommendation that the boards sit down and resolve this issue if it's at all possible. I hate to see it come back here because this is the worst place to try and define the scope of practice within these two very professional, outstanding fields of practice. So I will have to vote no on this today, and I just wanted to share my thoughts. Thank you, Mr. Chair.
Any other comments? Well, again, this is certainly a topic of a great deal of interest, especially in light of the Affordable Care Act and the efforts to expand health care. Similarly, we are concerned with consumer protection, and so we're trying to reach a balance. And as my colleagues, I thought, have indicated rather eloquently, we've gotten lots of information on both sides, and I think we recognize that we are not the experts. We don't feel comfortable sort of being the arbiter between two learned professions, at least in this legislation. But Senator Yee, you may close.
Thank you very much, Mr. Chair. Let me touch on a number of points that have been raised relative to the fact that I think physical therapists feel that they can, in fact, do what they are not supposed to do. But let me address, I think, Senator Emerson's issue, and I think some of the other senators about it is a difficult issue. It is a tremendous challenge. But the reality is that when it comes to issues of professional scope and professional performance, ultimately it is this committee that deals with it. Rightly, wrongly, whether we like it or not, this is in fact the B&P committee. And I think all of us have a difficult time learning the specific functions and responsibility and skills and talent of each profession. But this issue is not about that. It is a really straightforward issue of whether or not the issue of manipulation and adjustment is within the scope of the chiropractors, and whether or not, in fact, physical therapists can, in fact, invade that particular scope. And that ultimately is what needs to be decided with this particular bill. There's been some discussion that says that, well, I use my hands, and that it's not unsafe. There's no data that somehow supports my not doing what I've been doing for a long time. Well, if you are a physical therapist and that's what you think you ought to do, then do a bill. then there are others that says that, well, in my profession as a physical therapist, I've been trained to do all these things. I've been trained and I have clinical experience about how to do manipulation. Well, if that is the case, then do a bill. Just do a bill that expands your particular scope. That's all we're saying. You cannot have a situation where, as a psychologist, if I take some course in dentistry and I don't hurt anybody and there's no complaints, that I can do dentistry. It doesn't work that way. We are a state of laws, and we are a rule of law. And the law states that these are your scope, and you ought to then stay within your scope. To some extent, I'm really sad, about the physical therapists and who educated them. At some point within one's course of study, you would hope that they understand what is ethical and what is legal and lawful. Just because I don't do any harm to my patient doesn't give me the right to then do something that is not within my scope. I have to somehow respect that scope, because if I don't respect that scope, then who's going to respect my scope? Why not massage therapists invade physical therapists? Why not some other individuals just invade the physical therapist? Because I've been trained to do that. I've had clinical experience to do that. And on top of that, there are some professors that somehow anoint me that I can, in fact, do all these things. But if it's not within my scope, I ought to stay out of that. And if I want to do that, then do a bill. Senator Hernandez is going to be looking at expanding certain individual scope. They are looking at maybe practicing at the top of their particular profession. But he then just simply anoints and said, well, thou shalt be able to do that. No, what he decided to do was, we're going to do a bill that clearly articulates exactly what we're going to do. And that's the issue that is before us. You have some physical therapists who are practicing outside their scope, albeit that they've been doing it for a while, albeit that they've been trained and so on. But the law is the law. It is not within their scope. Now, they can say it's in their scope, but it's not. All you have to do is just look at their scope, and there's no designation of adjustment or manipulation. There's no reference to that. And all my bill will just simply do is to say that those individuals who want to do adjustment and manipulation, but they ought to be a chiropractor. And that's as simple as that. So with that, Mr. Chair, let me just thank you for your consideration, your fairness, in allowing us to present. And with that, urge an aye vote.
Thank you. Thank you, Senator. Secretary, please call the roll. I'm sorry, is there a motion? Okay, we have a courtesy motion by Senator Hill.
To pass to appropriations.
Secretary, please call the roll.
Price, Emerson, Locke, Corbett, Galgiani, Hernandez, Hill, no, Padilla, Wyland, Yee.
Aye.
Yee, aye.
Okay, 1-1. We'll leave that roll open.
Thank you very much.
Thank you. Thank you, Senator. Thank you to all the witnesses, and thank you those of you who came to participate in this hearing. I appreciate your courtesy and your cooperation. Thank you. Is he here? Okay. All right, members, we're going to move to item 7, Senator Steinberg.